Good evening, everyone. Hopefully everyone is getting joined on. I am Dr. Brooks, and I am actually myself getting stuff on here so we can get started. Tonight we're talking about options and alternative treatments for struggling children, and this is a topic that I know a lot of people are curious about, need to know more about, all that fun stuff. So I want to make sure that we kind of get into this and get moving, if you will. So I'm going to just put I'm putting the sharing because I'm going to kind of get open right here. Okay, sorry, having a little technical issues, if you will. So I am sharing the a couple of the notes that I have for tonight. So you can open those if you'd like. They will also be automatically emailed to you after this session. So it'll be something that you can get in your email if you're just tuning in via call. So I'm just going to put okay. So as you join on, I can kind of see where everyone is, what's everyone's doing, all that fun stuff. So
All attendees are muted.
Okay, so I muted you guys because last month we had an issue. I kept hearing thing background, which is really difficult, as you probably can imagine. So getting a little bit of a late there. So let's just dive right in. Sorry for the pause. So again, we're talking about options and alternatives for your child tonight. If you are joining us, listen to this recording, you can email the office for the notes and they will forward them to you once you have attended the webinar. There's just going to be a couple things that I found to be really important to have from this webinar. So feel free to grab a pen and a paper so that you can write down important things that might be really geared at your child. So these are the objectives for tonight. We're going to go through common factors contributing to behavior, poor sleep, skin issues, allergies, and illness, the current pediatric model of care, red flags to look for in your children, which I think are super important, common treatments being used, and the 3 R's that you can work on with your doctor. So I love to go through those with you so you know kind of what to expect when you're looking for a doctor and what you might be in for if doing a biomedical or a functional medicine approach is something that you really want to do. And then some necessary nutrients I recommend, and then diet recommendations. So we have a lot to cover in an hour. So we're going to dive right in. This warning and disclaimer that this is for informational purposes only. I'm not providing medical care to you or your family because you're not a patient of mine. So you'll need to obviously get with the physician that's treating you for any kinds of questions, diagnosis, or treatment. Writes, this is my content and you need my permission to duplicate it. So you can contact me if that's a necessary deal for you. And then of course, a little bit about me. I own Whole Child Wellness Center here in Dallas, Texas. I have a pediatric only practice focusing on children that have delays, chronic illness, behavioral issues, and we really focus on early intervention with them. I like to use an integrative approach in practice. I have found that it works really, really well using nutrition, development, chiropractic, and really finding the underlying cause for a lot of the symptoms that parents are reporting their children are suffering from. I think blending both really gets the better model, I guess the better care and model for children for lifetime wellness. I am a board certified pediatric chiropractor, so that's my license. I'm also a nurse and I'm a craniosacral therapist. So those are kind of, my education background. I did author a book called 15 Things Your Doctor Doesn't Know About Your Child, and it's everything that I would want a family to know, kind of the basics, if you will. So I think it's a great resource for you to read, or even give as a gift. So it's right under 200 pages. It's pretty easy to read, and I cover everything from infancy through GI, food, what to look for, what to be worried about. So I think it's a pretty good, comprehensive, quick read on kind of ways to help you in questions answered that are not typically given. I also started a nutrient line called Healthy Kids Nutrients, which you can find online at healthykidsnutrients.com. Of course, my website if you want to check out my private practice, and then my personal website for any consulting, and the course that you're on tonight, for instance, is on that website. We're also on Facebook. I know a lot of you may have found out about the course through Facebook because we do Facebook postings there. So we're at Whole Child Wellness. We also give lots of other information. So it's a great place to get resources to pass along to your friends that have children, or to pass along to your physicians, or obviously if I have any physicians on the call, to pass on in a newsletter format to your patients. I'm also on Twitter, and we do YouTube videos. Once a week I post them. They're short videos on commonly asked questions, things that I'm getting in the practice that I feel like many parents are probably struggling to answer. So it's really my 5 to 10 minutes to really get on camera and help work through typical things or explain certain things. So utilize that, because I think it's really helpful. And I think we have about 16 videos up now. So we're going to start right in. We're going to dive right into contributing factors with food, skin, allergies, and illness. This is really important. A lot of people will ask me when they come into the practice, why is this happening? And not in every instance can I, pinpoint it initially, but we always get down to the bottom of it. So I think what's important to know, behavior can be all over the map, as you see listed here. It can be from poor concentration, lack of focus, an actual learning disability, anxiety, headaches, things like that. Skin issues, we see a lot of kiddos with reoccurring rashes or eczema types of conditions that are really unexplained, or haven't so far been helped with medications, topicals, etc. Allergies, that could be allergies to food, allergies to the environment, which are usually really more of an immune dysfunction than anything. So, and then of course illness. So kids that are getting recurrent ear infections, recurrent chest infections, recurrent strep infections, those are things that really, really need to be addressed, and that will contribute to the challenges that children have. So these are some of the things that I just kind of wanted to bring up. As far as the doctors that our children see, the list goes on and on. Some of you may see most of these. Some of you might be just starting on your journey and not have any. Most people do have a pediatrician. That's kind of in there, kind of every kiddo has one. In addition, you may have specialists like GIs, doctors, a chiropractor, a functional medicine practitioner, a DAN doctor, for those of you that know what that means. It used to be Defeat Autism Now we've really moved into the more current model, which is the MAPS doctors, where we get together as functional medicine practitioners. And the MAPS program is dedicated solely to pediatric patients with special needs. So it's a great organization, giving some really great education to us. ENTs, of course, immunologists, the list goes on and on, right? So within that, you also have therapy. A lot of the kids are in therapy. So the parents are really, I think those of you that are going through a lot of these doctor visits and therapy visits, it's kind of a matter of what do we do? What do we pick? All that fun stuff. And I'm not really here to tell you what to pick and what to do. I'm really here just to give you some background tonight on options. And these might be some options that you would think about if therapy is something that you want to do. I'm a huge advocate of therapy for children, and I will oftentimes, if they are not already in therapy, I will often recommend specific therapies for children that I find in that specific case will be helpful. The only therapy on this list that I do is craniosacral therapy, which we'll talk about a little bit later this evening, but all the rest I would refer out for in my specific practice. So again, these are therapies that you may want to think of or that you're already doing. This is the current pediatric model, traditional medicine kind of versus alternative medicine. In a traditional medical model, they will observe, they will diagnose, and they will treat any psychological components first, taking into account the behavior of the specific symptom, right? So let's give an example. The school tells you that they think your child has ADD. They need to be seen. So you go to the doctor, they get seen. You tell them about the behavior, which is the specific behavior and symptom, and then they go ahead and give you a medication that may help you with those symptoms. A lot of times they are not doing lab testing. And if so, a lot of it's being done improperly, meaning they're either not ordering the right types of tests or they're interpreting the tests incorrectly. And that's just what they were taught to do. So when I say incorrectly, that's kind of a gray area, but it can just be differently, because their version of it is correct, but a functional medicine trained person is going to look at it a little from a different point of view, from a different vantage point. So I will a lot of times point out things on lab testing that people bring in that nobody ever bothered to tell them, because what they learned is that specific thing being high or low doesn't really add any value, and it very much could, right? And I guess that just depends on your experience and or your specialty in practice. And then of course, the overuse of medications, right, for recurring infections. I don't think any of us need to talk anymore about that because we know that happens. And then of course, psychotropic drugs as a first line. I think that psychotropic drugs, I'm very familiar with them from my nursing background, but I will tell you that I really don't think that they should be a first line of defense. I do think that there are children out there that do need them, but the dosing is usually wrong, and the way that they are following them via lab testing, because that's not being done, should be done, especially when you are having kids on medications like that for 5, 6, 7, 8 years. So it's really something that if I have a kid that's on medication and that's the choice that the parent wants to keep, however, they're coming to me for another symptom, I will often just make sure that that their labs look good and that there's nothing kind of out of whack that the medication would be causing as a side effect. So definitely something that even if you want to stay on medication, that's fine, but make sure that the medication is working, that the body is handling it well, and that detoxification pathways are safely working. The alternative medicine on the other side of the coin is really observing, diagnosing, treating the physiological components first, right? So getting down to really the root cause of what's going on in the body, not just whatever psychological symptom that you're telling us about. So we're taking into account the full clinical picture. I would say in alternative medicine, we do very traditional medicine testing. I mean, at least I do. So that's why I blend both of these columns in, because I think that there's a need for both. So proper lab testing is really done to address specific deficiencies and issues. And it really does give you a really nice black and white, I guess, map of what's going on with that specific child and what you need to do to fix it. Obviously, you don't know what you need to do to fix it when you're looking at your own labs, but your physician should know what to do and what proper tests to do and what proper steps to take to get those things better. Treating the whole child is really, really important, right? We're used to going in with a symptom and wanting to get something to alleviate that symptom. And I think, and I'm hopeful that parents are really realizing that treating the symptom is not really getting at the reason why it's happening. So if you're really looking at the whole child and how they're functioning, that's the best way to really get long-term relief for the child and wellness for life. So hopefully that helps kind of give you a picture of how they're different, and the same. More different though, I think we'd all agree. So here's some red flags that I love for parents to know. And usually on these calls, we do have other physicians and therapists and other other colleagues and professionals. So I kind of like to give you, as the parents, both sides of the coin of what you want to look for and then what maybe a professional is looking for when they see you. Parents really want to be asking yourselves, are you getting complaints about violence and or complaints about behavior? And I know in today's times, teachers are emailing and texting, which is great, but also kind of a pain if your child's having some major issues. So this is a red flag that you need to get some help and that you need to seek out some care. Are they sleeping? And this means, are they falling asleep easily? And are they staying asleep all night? Those are the two questions that are within that you need to ask yourself. Some parents really don't know because their kids are older. So I just did a YouTube video on using the Fit bands to help track how well your child's sleeping. So if you do have one of those Fit bands, I would say as a fun experiment, see if you can put it on your child's wrist or ankle, depending on, or forearm. So I know some of them will still work when they're up on their arms like that. And see how they're sleeping, how much REM sleep, how many times a night they're waking, all that fun stuff. It can really tell us a lot about why they might be tired or lethargic or not feeling well or having headaches. So something to keep in mind. And also, are they a picky eater? Some parents think that, because they've been told that picky eating for children is normal, and it is not. Picky eating is not normal at really any age. So if a child is picky eating, it is a great sign that their tummy hurts, even if they're not complaining about tummy pain. For those of you that know a child that's on the autism spectrum, or maybe have a child on the autism spectrum, you will know that they have incredibly high pain tolerances. And so do a lot of other children that are not on the autism spectrum. So you can't always count on your child to complain about a stomach ache. And the way that I tell parents is, if they had a stomach ache their whole life, they wouldn't know the difference, right? So we don't want to rely on their reports of pain. But if they're complaining of pain, then you definitely have to do something. So picky eating, is something that's a red flag for GI stuff that needs to be looked at. Do they have a bowel movement daily? Again, this is one of those things where it boggles my mind, even in this day and age, that we think that it's okay for a kid to poop once a week. And we think that's okay because the doctors tell us it's okay. And it is not okay. We want them having at least one bowel movement a day. And I mean normal consistency, not a hard time getting it out, no funky colors. If a child, or if your child is having a poop a week, which I just had a new patient today, my heart goes out to that little kiddo because the tummy's got to be on fire. I actually sent them for an abdominal x-ray to see just how bad it is, because I foresee it being pretty awful. So you'll want to look at how often are they going, if you're not sure, because I know past the age of 6, a lot of times they, do their own business. I would get a poop chart, put it on the back of the wall in the bathroom, like just print out a calendar from your computer and get little stickers, and they can put a sticker on each day that they poop. And that can help everybody keep track of it without having to have a big conversation about every time they poop. Now, if you're a family that's very open and you talk about poop all the time, like we do at our house, then it might not be a big deal. And so in that case, I always tell parents, tell them not to flush it and come get you, because I want to know what it looks like. How, a lot of times parents don't pay attention to it unless I ask them to. And I've had parents say, we went into the bathroom and it was so big it wouldn't flush. I had no idea that it was that big or that, that voluminous. So it's really something important, as gross as it sounds, for you to really take a look and see what it looks like. And then, of course, for parents, are they hard to manage? And this could be changes in routine or hard. It's hard to go to certain places. It's hard to manage them in a social situation. Whatever it is that you find really troubling, that is a sign that you need to kind of get some help. And we'll talk a little bit about options tonight. Professionally, we are looking at, do they struggle to complete tasks? Are the parents or teachers having to redirect them constantly? Do they get angry or show anxiety easily? And a lot of times kids that have anxiety are actually in pain. I have a new family in the practice I was speaking with today, and they said that she has incredible anxiety. And I think a lot of anxiety and emotion in children comes from pain. When they're real clingy and they don't want you to leave, things like they don't want you to leave is really because they don't feel well. It feels better when mommy's here. It feels better when daddy's here. So we always want to take a look at if you're going to go to the doctor and say, my child's having anxiety, be very prepared. I hope they ask for you to explain what that looks like. Because anxiety to me and to a parent, we could be talking the same language or we could totally not be. Your label for it doesn't necessarily mean that's what it is. I really want to know more about what you're seeing so I can get a good picture of what's happening. Have they seemed to hit a plateau in advancing in school or therapy? Very, very common. Therapy is fantastic. And a lot of kids will hit a plateau at some point and not be able to overcome that next hump. And a lot of that is medically related. What's going on inside their body that's causing things to be just a little bit of a mess. The other thing I see is children that could not go to therapy, whether that's behaviorally or the fact that parents were spending money on it and nothing was getting done because their kids could not partake and follow directions in therapy. Often when they got under care and they were addressing the other issues going on, they were able to get into therapy and have some really great improvements. So you might be experiencing one of those two things. And then the other thing that we're examining is we're looking at the skin for any bloating, dark circles under the eyes, rashes on the skin, things like that. So these are all things, of course, as parents you can answer and look for, but really, really expect to have to explain in detail what the behaviors look like exactly, what sets them off, or do you not know what sets them off? Those are all very, very helpful things for us to know clinically. So common treatments. What are things that parents do? Proper testing. And this is in no real specific order. I kind of just wrote it as I was thinking it, but proper testing is huge. I always explain to parents, if you want to go in and figure out what's going on with your kid, I have I do have parents that come in and they're very focused on one symptom and they're not really seeing it from the whole picture because our traditional medicine model has taught them to focus on the symptom and get rid of symptom, right? Just like we talked about earlier tonight. But really what testing does is it tells me the things that you can't tell me as a parent and that the child can't tell me. It tells me what's going on in the body and where are things broken. So I know what to fix, or your doctor knows what to fix, right? The other thing, common treatments, addressing nutritional and immune deficiencies. This is huge. 70% of your immune system is in your belly. So if nutritionally things aren't right, your immune system innately is not going to be working right. If your immune system isn't working good, nutritionally, you're not going to pull the nutrients that you need to from food. So they do very much go hand in hand. Changing diet, very important too. And this really can be individualized by your provider depending on what you're struggling with. So you'll want to seek some guidance on that. And then adding in necessary nutritional supplements. And I say necessary. So what this means, parents, is not going onto Google or going onto a chat group and deciding that you're going to go buy a bunch of supplements that somebody else bought because they worked for them. Now, can that work for you? Sure. If it's basic stuff that they've had a good experience with, like a multivitamin, a fish oil, something like that, no problem. But if you're going to try to do work on, I would say, on a methylation standpoint or on hormonal stuff or on neurotransmitter things, I will caution you now, it is a bad, bad, bad idea. You want to add in the stuff that your child needs specifically, not just stuff that you read about or your friend is using, right? Because that stuff that your friend is using might be really great for their child. The other thing is any prescription medications as needed from the abnormal labs. Like I said, there's a time and a place for those, but you really want to be sure you know exactly what it is that you're trying to get rid of and exactly what kind of medication is properly used for that in children. Craniosacral therapy and chiropractic, obviously a huge advocate on this. I'm actually going to be doing a YouTube video of me working on an infant. I actually shot the video this morning with her. She's 6 months old. And I'm also going to be talking in detail about craniosacral therapy, but you can read about it on our website. And in our welcome video, I'm actually working on the children the entire time. So you can kind of see what it looks like. But again, that YouTube video should be coming in the next month. So if you get on our Facebook at Whole Child Wellness, you'll be able to see it there. But craniosacral therapy, very, very gentle therapy. I'm going to touch on that in a little while. So I'm going to skip over that for now. And then chiropractic, a lot of you have been adjusted. This can be tremendously helpful for children that are having trouble calming down, trouble being calm, kids with ear infections, kids with colds and sinus issues. So again, you can read about a little more detail, but I always say it's a great thing to have a chiropractor seeing your children. So if they get sick, that's the first person you go to instead of running down to see somebody for an antibiotic that you may or may not need. Proper evaluation for school placement and therapy. This is really important. It's sometimes the evaluations done at school are not great. And I know some of you have had that definite experience. Whereas I make referrals again to my patients for therapy, and I know a lot of proper evaluation, the portion of that is very, very important to know what kind of therapy to expect and what is going to be good. So that may be something you would want to look into. Therapy, of course, OT, occupational therapy, speech therapy, social skills, etc. So the key to health lies in the gut. That is something I firmly believe in. So whether it's behavior or skin or immune stuff, it's all interrelated, right? The body works as one whole system. So stage 1 of assessing and treating children really got the basics of the digestive system. So I wanted to give you just some quick factual information about the digestive colonization that begins when babies come out, right? When they're breastfeeding, and that continues. So to date, at least they've said that there's 10 trillion bacteria, right? And that's a crazy amount. And we only know a very small portion of them to put into our things like probiotics. 70% of the immune system is localized in the digestive system. So if the digestive system is a mess because diet is poor, or they have food allergies or food sensitivities that you are unaware of, or they're picky eaters and they're not getting what they need nutrient-wise, then we can't really expect their immune system to function. And in general, we can expect their brain to function because the brain and the belly are connected by the digestive system. So it is really important for behavior because that's how we see bad behavior. At birth, the digestive system is nearly sterile. There's debates on whether it's sterile, and then there's new stuff that came out that said it's not sterile, which means you're starting out with nothing, right? So I put nearly because they're saying, well, we don't think that we're born without nothing. We just don't think there's that much there. But as we introduce foods, a diverse population becomes to develop in the gut. And when we start adding in solid foods, especially grains and sugars, it starts to alter that flora and can cause an abnormal immune response. And a lot of people will start with grains when they have babies because it's something that we're told to do, whether that's oatmeal or rice cereal. Those things are really, really difficult for a little baby to break down. Other causes of flora imbalance could be essential fatty acids in mom, infections, stress on mom and on the baby. Early vaccinations can sometimes cause floral imbalances, multiple rounds of antibiotics, of course, and different prescriptions. So that's probably the most common thing that imbalances our flora is the antibiotics. Dysbiosis, this is a word that will see when lab testing from your doctor and they go through stool and urine testing with you. But dysbiosis, I always like to explain it because a lot of people use the term and write the term. And this really is just a state of imbalance. And that could be from a bacterial source, a parasite, or a fungal source. So anytime we say that, we're most often referring to the digestive tract or the skin. But no two children will typically present the same. And that's the wonder and the beauty about why I love working with children doing functional medicine is because each kid is so different, even if they have an imbalanced ecological system, they don't have the same imbalance. So that's part of the mystery and the fun of helping your children. So inflammation in the gut. So I did just touch on the fact that if the gut is a mess, they're connected. Brain and gut are connected by the digestive system. So I wanted to just kind of touch on this quickly. I have done other webinars this year about really going and diving a little bit deeper into the gut. So even if your child doesn't have autism, I did autism and gut and how it's related. It's really an hour long about gut. So if you want to know more about that, you can watch that webinar, which you might find very helpful. So the gut brain, right? We just said they're linked. So what happens typically, and I say typically because kids that come in my practice are not doing these steps correctly. Their bodies aren't, at least. So they're eating food, they're digesting it, absorbing it, assimilating it, and excreting it. Typically, somewhere along the lines here, kids are struggling with every section of this or one section of this. And it doesn't matter whether they're having trouble with one or all, it needs to be improved. So my picky eaters, they might not be eating much food. Most of the kids that I see don't digest it well. And that could be not digesting carbohydrates well, not digesting protein right, not digesting fats easily, and then absorbing it. A lot of them have leaky gut, right? I'm sure a lot of you've heard that term, and that's where food's allowed to get through those channels without actually digesting. So it's not absorbed well. And when it's not absorbed, it's not assimilated, which is the process of taking nutrients from that food to be used in the body. So that's why when I back labs, the kids are very, very deficient in vitamins and minerals because the nutrients from food was never absorbed and assimilated. And then, of course, excreting. A lot of the kids are coming in with stooling issues, either accidents or constipation or diarrhea. So whatever it is, they're having issues with excreting waste, large volumes, very stinky stool, whatever the case. So the digestive system in the gut in general is the key to unlocking many issues with children. So whether that's an immune issue, because we go back to the gut, whether that's ADD, because the brain is kind of wiry, that's gut. Whether it's picky eating, that's the gut. Whether it's skin issues, I always say skin issues are a great way that the body is showing you, literally, this is what's going on the inside. So I'm going to show you on the outside so you pay attention to it and fix it. The neurological and behavior issues that we see get better when you treat the gut. And that is a fact. That's not my opinion. That's actually a fact. And it's really what I've spent the last 8-9 years doing. So this, I love this picture. I use it in several, I've used it for years. And I always look at this and kind of think, oh, standard American diet. And this girl, as you can tell, is overweight, of course, but tired and beat down, and she's got potato chips and cookies and candy wrappers and all that fun stuff. So, of course, we were going to touch on the 3 R's, right? So what am I... Hold on just a second. Sorry, y'all. Had to bring my dog to work, and he just went crazy at the cleaning people that came into the office. Okay, so the 3 R's, treating the digestive system. So we've been teaching this to parents for probably 20 years. And it's changed and we've updated it a little bit. But the 3 R's are we're going to remove, we're going to replace, and we're going to repair. So the removal part of it, and I gave you a copy of this slide in the notes that you need to click on in the chat box there. But you're going to want to remove any pathogenic organisms that your doctor finds in stool and urine. Will help you get rid of those things, right? They'll help you work through how do you get rid of it, all that fun stuff. Anything that your child is allergic to. So if you've done allergy testing, whether that's food sensitivity or food allergy, you need to get rid of them. If you did food sensitivity testing and a ton, let's say 40 things came up positive, that really means that you need to do gut healing. So you need to go, you kind of went 10 steps ahead and didn't kind of heal the gut first. So if that's your case, go back, find somebody to help you work through the gut work. Metals, of course. Refined foods, those are your unnatural processed foods. Artificial colors and dyes, and avoid chemical cleaning products. Mercury, obviously, in dental work, you need to avoid. And then in vaccines, if you can. And then food additives, right? Like your fake sugars, your aspartame, and your MSG, which is, they'll put it on the menu free of MSG or whatever. As far as a lot of people will ask about the gluten and casein free diet. And this is a very, very popular diet. I'm a big fan of it. I think it's a pretty, of all the diets, it's the easiest thing to do. So when we're talking about removing, I would like you to think about removing grains and gluten specifically. So 70% of children with untreated wheat allergy show exactly the same abnormal brain wave patterns as those who've been diagnosed with ADD. And then they did a study that 1 in every 133 people have celiac. So this is an important test you can run. And then 80% of children that I have seen have a gluten and casein sensitivity. So a lot of times, even though we take it out, a lot of times parents choose to keep it out because they reintroduce it and they go bonkers, right? And the genetically modified grains are contributing to this epidemic. And casein, a lot of you know this stuff, so I'm kind of going through it a little bit quicker, but I wanted to have it in here. So gluten and casein. Gluten is the protein found in a lot of things. These are the basics. Casein is the protein found in all forms of animal dairy, so goat, sheep, and cow. And what happens is if your kid is drinking tons of milk or eating nothing and craving nothing but carbs, breads, all that fun stuff, they're really addicted to the peptide in it, the protein, because it works and gives them kind of a high. So they become very addicted to it. So a lot of parents say, if I take it out, they'll starve. And truthfully, they won't starve. However, taking it out without working with a doctor to give them digestive support sometimes will lead to you not being successful. So I would say, talk to your doctor about going gluten and casein free and really allowing them to give you the proper support so that you're successful. I find that works best. Also, eating gluten and casein will help with inflammation. So even if you do it for a period of time, I always say, try it out for 90 days with your doctor and see how it works. And then, of course, inflammation is a big thing. It's a big thing with kids. It's the reason why their brains are on fire and they're behaving horribly. So when you can take out, sometimes you get real lucky. I'd say about 70% of the times parents notice a behavioral change. They notice a stooling change. They notice, different things. They just notice differently. So getting rid of inflammatory issues or contributing things is a huge way that you can help the gut out. So let's continue. So we just talked about removing those things with your doctor, and we talked a little bit about gluten and casein. So what are you going to replace? Probiotics are important, and you'll want to get with your doctor on their recommendations on this. Minerals and vitamins as needed. So a typical urine test that I run will come back with a full mineral and vitamin panel. So we know what's deficient, how much of it do we need, so we can, go into any extra supplementation that's needed beyond a basic vitamin mineral. Amino acids as needed in organic foods, of course. If you can do all organic, great. If money is an issue, I would say look up the clean, I think it was at 30 dozen and clean 15, just do a Google search for that. And you'll get the foods that you should really buy organic because they have higher pesticide stuff versus the stuff that you can, buy elsewhere. So I think that's the Dirty Dozen Clean 15. So repair work you're going to do with your doc, right? You're going to repair that dysbiosis, whatever it is. You're going to build up the immune system. You're going to decrease inflammation through diet, through supplementation. You're going to address the nervous system, the behaviors and the inconsistencies in what you're seeing with chiropractic and craniosacral therapy, and then repair their body with food. Food can be a tremendous healer. It can also be something that just is a killer. So this is really something important to get down, especially long-term. What can you do long-term? I always do very specific long-term diets for the kids. So it's very much individualized. So it's possible to do. You just have to work a little bit on getting some testing back and healing. Craniosacral and chiropractic for kids. The basics are the autonomic nervous system, which is made up of the sympathetic, which is that fight or flight response, and the parasympathetic, which is kind of the resting and digesting portions. These two systems have to be balanced to be happy. So common symptoms that our kids have when those systems are not balanced are a lot of the things that parents come in telling us are problems. So you can kind of look at this list and tell yourself if these things you see or you don't see. But these are the things that balancing that autonomic nervous system can help with. I will say, I think I left out sensory issues. I did, but I have used craniosacral specifically for sensory issues, and it is tremendous. So if you, obviously, if you live somewhere where you can drive to us, you can come here. If you don't, you can go to the Upledger Institute online and try to find somebody in their directory. You may have a hard time. I would tell you to really be looking for someone who treats children and who has quite a bit of experience, because you can make things worse if you don't know what you're doing, So this is something, or ask your chiropractor that you go to currently if they know of anybody in the area that does craniosacral therapy. But a tremendous benefit, the both of these together. I never do one without the other, but that's because I know how to do craniosacral therapy, and it is not a technique that every chiropractor does. We each have different techniques that we do. So definitely something you may be able to find, but I would highly, highly suggest it. This is me actually working on he was 33 weeks when he was born, and he was baby Cannon, and that was a very long time ago, I think. I think that was about 8 years ago when I took that. But craniosacral therapy is really gentle. So as gentle as you can see my hands on his head is what it is, and he's conked out, he's sleeping. So it's actually very relaxing. It's a hands-on therapy. So for my other kiddos, they're, watching TV, or they're distracted with a book, or mom is playing with a toy with them, or playing a game, or singing to them, or, whatever it is that specific child likes. But craniosacral is really great at evaluating and enhancing the functioning of that autonomic nervous system. And we're really working with the membranes, the cranial bones, and the cerebral spinal fluid. So it's never a therapy where you're pushing on the bones or that's painful. So I know I've had families that said they have gone, and that's the experience they had, and that's unfortunate, because that's not the experience they should have had. So really the weight that you're putting on somebody is about the weight of a nickel. It's very, very, very light. And again, you can read more about craniosacral therapy on our website at mychildwellness.com. And like I said before, I will have a video coming where I'm actually working on a 6-month-old on the video on the YouTube. So I'm going to do a YouTube video about CST. So now what? So we've talked about some of the symptoms. We've talked about where they could be coming from. We talked about the 3 R's. So it's really time to look at replacing foods, replacing vitamins and minerals, and other supplementation as you start kind of on your road to recovery. But I really think it's important that you pick a doctor and that you have proper testing done. I'm not really a good person to ask about, can I just give supplements and see how it goes? The answer is, I just don't really think you should gamble with your child's health. And that's quite frankly how I feel about it. I think that the child deserves to be treated like an individual and not kind of like a guinea pig. So I would like it if you could find somebody who did functional testing. Again, we see parents from all over the United States. So if you're interested in coming into our practice, you can call us. But if you want to see someone in your area, someone in your area that does work with children, then I would really push you to kind of go and do a visit and see how that goes. So let's quickly talk about nutrients necessary for growth and development. This is a mineral that I think there's just a couple things every kid should be on in general, and I think a multivitamin is one of them. This is an allergen-free vegetarian capsule. It is free of gluten, casein, eggs, peanuts, wheat, corn, fish, soy, stearates, preservatives, yeast, all the fun stuff. I formulated this myself because I had a hard time finding a supplement for children that was a vitamin mineral in high dose active forms of vitamins and minerals that was, I would say, good enough for the kids. The reason why I did a cap and I did not choose to do a liquid or a powder is because it's really hard to avoid preservatives, colorings, dyes, and flavorings when you use other sources. So this actually mixes wonderfully in a little bit of orange juice or a little bit of lemonade. I don't have any problems with it. With the kids, they've taken it really well, so it's been good. For the littler kids, I have kids I'd say as young as, I think my youngest right now is 3 years old, and she swallows pills. So there's some great YouTube videos on how to teach your kids how to swallow caps. So trust me when I say it's possible. And then, of course, like I said, obviously it was designed really to be opened and put into orange juice or lemonade, but we do use all biologically active forms, which basically means that the body knows what to do with them, absorbs them, and utilizes them just as they are. We do whole nutrient family, so we're not piecemealing. We're kind of doing the brothers and sisters that are needed to really optimize the vitamin the best way that we can. It is GMP certified and gluten-free. And then, of course, it uses minerals that are tracks, which are one of the, I would say, probably the best minerals on the market because they're the only patented, scientifically validated chelates on the market. So we were able to get those in the multivitamin. And then, of course, my most excited thing that I'm excited about is it has quattrofolic in it, which is the newest form of active folate. This is really, really important as we're learning more about our kiddos and ourselves that have MTHFR to get active ingredients always and specifically the best type of folate into our bodies. So this is really exciting that we were able to do that. So parents can order that on healthykidsnutrients.com. And then, of course, if you're a doctor on the phone, you can purchase wholesale through us directly to sell in your office if you'd like. So that's the first thing. Multivitamin, super important. Here's some other basics that you may want to consider. And both of these slides actually are in your notes that I already attached to you. If you're tuning in by phone, you will get the notes emailed to you. The system automatically emails them to you after. So not to worry if you're just on the phone. Speak Nutrients. This is my favorite fish oil. I've been using it for a long time. And so it's definitely something you should check out. You can go to their website and look at it. You can order it from them. You can also order it on our website. We actually feature their fish oil on our website as well. Multi-strain probiotic. We have a variety in our probiotic line you can check out. You can go on to Healthy Kids Nutrients and look. I believe right now we have 4. So you can look at the different species and the different billions per cap and decide on something that may be good. I would say there's more data coming out that we don't necessarily need to change probiotics nearly as often as we thought, but I still like to change up the probiotic that parents are using probably 3 times a year. I would say would be a good kind of thing to do. And the reason is if you're buying your probiotic at Whole Foods or at one of the other health food stores, a lot of them carry the same type of probiotic. Everything that I use or I advise my parents to use is a pharmaceutical grade supplement. Theirs are not. And so what happens a lot is when I do testing and I back testing, I see probiotic strains that are in there and everything has bifido and acidophilus. And a lot of those other probiotics that are being sold at the grocery stores don't have all the other varieties that you need that are in the, I would say, the nutraceutical line of things, which ours are. So check out what you're using and what it has. And then when you're ready to switch, you can kind of check out the different strains that are in the different probiotics for you to switch to. I also love Enzymatica. They are an enzyme company and we use the intolerance complex by them. This is also for sale on Healthy Kids Nutrients. We only feature, I think, them and Speak aside from our line on there. They do a fantastic job at enzymes. So they will also send samples to you. So you can call the company maybe. I don't know if they'll send them to parents. I know they send them to docs. So if you can ask your doctor, they can get samples. We always give samples of this on a visit, a first or second visit. We give it to the families for them to try. And then vitamin C, super important for kids. Ours is called Super C, and it's a powder. It's a buffered vitamin C powder, orange flavored. It tastes really good. The thing about vitamin C is it's used as a component, as we all know, in the immune system, but it's also really heavily involved in transporting other things in the body for detoxification. So it's really, I'd say 99% of the time I find it deficient in children. So I always say it's something from a basic standpoint that you could do that would be perfectly safe. You can't really overdose your kid on vitamin C. The only thing you can do is give them excruciating diarrhea. So if they get diarrhea, you want to kind of back down on that. So again, you can get these on healthykidsnutrients.com. Lifestyle changes. So of course, anytime we're talking about what's going on with my kid, what's wrong, you have to be prepared for lifestyle changes. This is a big one, right? So these are the things your child should eat. Obviously, unprocessed foods. This isn't always easy to do, right? But because we all work. So I would say things like My Fit Foods and Snap Kitchen are available, I know, in the Dallas-Fort Worth area. They're basically healthy places that make really healthy organic food. I know at Snap's Kitchen here in Dallas, everything in their refrigerator is gluten-free, and I don't eat gluten or casein, so it's really amazing. I can go in there, I can get dinner, I know it's healthy, it's cooked the same day, and I can get a really healthy meal and go home. Fruits and vegetables, of course, water, protein from free range sources, and then antioxidants are really important. So our B vitamins. I have done enough research to know that every kid needs a multivitamin, regardless of how, quote, healthy they eat. And you can actually read that on our website under at the mychildwellness.com. It'll be under the I guess the nutritional, like the supplement section, and you can read the paper that I wrote on it with all of the scientific kind of sightings. What should your child avoid? Artificial colors and flavorings. A lot of this you guys know, right? MSG, pesticides, aspartame, and other artificial sweeteners. So I had a parent ask me, well, how do I know what's in it? Aspartame is in anything that says sugar-free, and it's in most every single gum on the market, unless you're getting something like Spree gum, which they sell at Whole Foods, which is really good. And it's also in a lot of the candies. So it's something that you definitely want to pay attention to. It is a big component in ADD and ADHD and some oppositional defiant disorders. So definitely this is a list that if you have any of those or struggling with attention and behavior, this is definitely a list that you want to keep a good eye on and try to avoid. Obviously refined sugars and things like that. Nitrates in things like bacon, hot dogs, lunch meat. It'll say nitrate free. So that's all you need to be looking for. And anything that your child really craves, or that's associated with poor behaviors, meltdowns, or mood swings, you need to get rid of. And I know that some of you are like, well, duh, but you would be surprised at how many people continue to give their kids foods that they know are causing bad behavior because they don't get to have it very often, or it was a special occasion, or they wouldn't stop begging me for it. And I always say every time you give them those things, you're causing more inflammation and more problems inside their body. So you're making their existing problem worse. So I would really caution you, obviously, not to do so. I wrote a lot of information in my book for parents. I might have talked about in the very first couple minutes we were on the phone, and I know a lot of you hadn't joined us yet, but this is available on Kindle, iBooks, Amazon, Barnes & Noble, on our website. Of course, if you're like me and you like paper, then you can pick it up. And it's $14.95 or $15.95. I always forget. But anyway, this goes through everything from infancy all the way through. I give remedies for, in the back, things that you can do to kind of take care of things naturally at home. We talk about food allergies and gut and lots of stuff. The red flags that we went through, I go into each one of those is a chapter in the book. So a lot of great information for you to get. And I always say if parents, aren't too sure about getting started with care with their doctor, This is I always say the book is a great place to start because it gives you a really good foundation for what might be going on with your kid or the reasons for it, and really makes you more confident in making the decision to either go forward or not. So this is the hard part, right? Is how do you choose a doctor? This is tough. I always say start by writing down your goals. I think this is really important. Research based on the goals that you have for a provider and what philosophically you believe in, right? Obviously, most of our patients are very open to alternative medicine. Otherwise, they wouldn't be here. And then call the office that you're considering and schedule a consultation. We do a 20-minute complimentary consultation for any family that's considering coming into the practice, if they want to do that. And I think it's important sometimes to ease anxiety and also to see if you're a good fit for the office and vice versa. And then ask questions. This is really important. You know, what's their patient base? How many children do they see? What's their philosophy and practice? How, do they see kids often with the symptoms that your kid has? Any and all those questions you have the right to ask. And quite frankly, their staff should be able to answer them for you, but don't ever be afraid. You need to interview them just like you would if you were hiring, a nanny or an employee in your business. So this is really important. Of course, our next course, I'm actually taking August off. We've been doing these once a month since February. So I'm actually going to take August off. I know a lot of, everyone's going back to school. So it's a crazy month anyway. So it's actually a fantastic month for me to take off. But I will be back in September and it will be on our Facebook page. Clinicians, if you're on the phone, I am doing a webinar for you all next Tuesday on torticollis. Specifically, so that's open to clinicians only. So you can check that out and sign up. If you're considering coming into the practice, you're a parent on the phone and you have more questions, feel free to give us a call and talk to Jennifer, who runs my office, and ask her any questions. We do take patients from out of state, etc. So if you're not close or you're 3 or 4 hours away from Dallas, but you need help and you can't find anyone, that's exactly why we accommodate you, because we don't think that any family should have to go without care just because of location. So there are some things that can be done. So don't be afraid to at least ask the question. So I want to do a quick case time. Got about 3 minutes left. So I'm going to kind of bully myself through this slide. So kind of read along, if you will, because I'm not going to read everything. So this is a case type of an 8-year-old that came in. You have to understand most of my patients are male because of my specialty. So most of them are boys. Chief complaints were coming in were aggression, immune system, picky eating, behavior issues, sleep, and diarrhea. The behavior issues were so bad that they had to start homeschooling, and it wasn't by choice. I do have lots of families that choose to homeschool. This was they had to homeschool because they kicked them out of school. So this is really, really, really bad. He was sick all the time. He started picky eating from very, very early on. He was biting, he was banging his head, he was having tantrums for up to an hour at a time. And basically the parents thought, well, we thought it was normal because when we told him no or he didn't get his way, he'd have a meltdown. And we just thought that, we were doing something wrong. And very well, it could be just bad handling by parent of behavior, of course. Sleeping, had trouble waking in the night and falling asleep, and then diarrhea, pretty much since he was born. When I looked at him, when I examined him, he had eczema on his face. He had dark circles under his eyes. He needed to be adjusted practically up at the very top of his neck at C0 is what that means. His lymph nodes and neck were swollen, and that's probably because his immune system is not doing well, or he was currently sick. Treatment, we really addressed the diarrhea and the dysbiosis that we found on labs. We addressed the gut inflammation with supplements that we found on labs. The behavior and aggression we actually were able to treat naturally, which I was really, really happy about after finding out that he had low cholesterol, which is kind of weird. And I believe I blogged about this at one point, so you can go onto the blog site and sorry guys, my dog again. You can go onto the blog site and do a search for cholesterol, and hopefully it'll come up for you. But low cholesterol can actually give you behavioral issues. And then I coach the parents through giving supplements, because this was a really big struggle for them, and it is for a lot of parents. But I think our parents are successful in our practice because we really coach them step by step by step, whether it's diet changes or supplementation. We really, really help them. So within a month, he was doing really great. He hadn't been sick. He'd sleeping through the night. His pooping was normal. His face, the rashes on his face were gone. He was eating a little bit more and socializing and playing with others. The poor behavior was absent, which was short of a miracle. And that's what sometimes diet changes can do. And in general, when I saw him, he was just much happier. So we weren't out of the woods. It's not like in a month everything was gone, but the bulk of his issues that were really caught, like he could then enroll back in school. We were really aiming to do as rigorous of care out the gate as we could, because the parents, one of them had to quit their job. And that obviously is not an option, I think, in general, right? So that gives you, I was trying to think of a case type I had typed up before, bringing in all of the things that we had talked about tonight. So this is how you can stay in touch with us, by email, etc. And then these are the different websites that we talked about kind of earlier on. So I know we're over time for those of you that need to get off the phone, but if there's anyone that has a question, if you want to type it into the box, I'll be happy to answer it for you. So if you can quickly type in any questions that you have. Hopefully most of you've clicked on that downloadable PDF there to get just a couple notes that I typed up for you. And then, of course, and those of you that are just on the phone will get that emailed to you. And those of you listening to this recording after the fact will have to contact our office so that they can forward you those notes. So I don't see anybody typing a question. So I think I'm going to wrap this up. And I really want to say thank you so much for joining me. If there's a topic that you want to know more about, that you're curious about, that you wish that people would talk about more, I would love to get that recommendation. So when it's time for you to kind of give your feedback and kind of on, X. Make sure you follow us on Facebook. Bye.